Hi, my name is Brianna Contreras, and I'm Associate Editor of Managed Healthcare Executive.
Hi, my name is Peter Werwine, and I am Senior Editor of Managed Healthcare Executive.
We are very excited to be sharing a video spotlighting individuals selected for Managed Healthcare Executives' annual 10 Emerging Industry Leaders in Healthcare feature. This is our fourth annual feature, which is shared in our October 2020 issue. We ID candidates by nomination and independent research to identify 30 finalists, and then we window that list down to 10.
And the criteria we use for both the finalists and our final 10 is we look for people who have launched some key initiative, who have had an impact on healthcare, who have taken on increased responsibilities both in their current position and maybe in some past positions. In short, we look for leaders. And then to satisfy the emerging part of 10 emerging healthcare industry leaders, we limit our list to people who have worked in the industry, to folks who have been in it for no more than 15 years.
This is one of our favorite features of the year, where we meet great people to speak with and who belong to a range of fields in healthcare. We hope you enjoy the short video.
As a young person, I always was fascinated with science, and then as I went into college, I was thinking about it. I was thinking of a lot of different things, but really, I do remember a distinct experience when I was at the athletic complex, and there's actually a student playing squash in one of the courts, and they ended up collapsing, and they basically had cardiac arrest, and I witnessed just how quickly everyone mobilized, and actually the person that he was playing squash with was actually one of the physicians at the university. And so a lot of things were done very quickly, and he was stabilized and sent to the emergency room, and subsequently his life was saved, and that really just stuck out in my mind. And ultimately, I went into intensive care or critical care, which is really taking care of the sickest of the sick, and we do a little bit of that stuff every day. So it's a little bit of interest in the school stuff, but sometimes it's a vivid story that sticks out in your mind of something you aspire to be. For us, it's front row and center. We're a medical organization. We're also a virtual health organization. So we were doing telemedicine well before COVID. We serve 100 different hospitals in the country with telemedicine services in the intensive care space. And so when all of this happened, we were in a position where we were already familiar with administering healthcare in a virtual environment, but there was still a lot of things that we learned on the fly on how we can continue to improve and be of more value to our partners. And then also for us internally, in what we did, we wanted to make sure we had the utmost safety in terms of protocols to protect all of our employees, all of our healthcare workers, even though they're operating in a virtual environment. And we learned a lot, and I'll give you some specifics. One of the things that we faced early on was personal protective equipment was in short supply. And a lot of these patients had to be in what we call negative pressure rooms. Well, having to go in and out of those rooms constantly takes a lot of personal protective equipment, and it also exposes people at the bedside in the hospital to potentially getting the virus themselves. So in our virtual health environment and telemedicine environment, we were able to use our cameras to take care of patients remotely. We even had visits where we were able to offer emotional support to patients and their families when nurses maybe didn't need to have to go into those rooms as much. We could look at a lot of the monitors remotely and be able to then convey information to the bedside folks as to when to go into a room versus when not to, or when that could be avoided. So really it's a combination of, we've been doing some stuff already in the space for a while, but we improved upon that so that we could help all our partners in the best way that we could, rationing their supplies, protecting them at the bedside, and then, of course, doing whatever we could for patients and their families. Very important topic, and it will continue to be here in this country. And luckily for us as an organization, we're very well spread out in multiple states, and our hiring practices really come down to, getting folks who are genuinely interested in medicine and telemedicine and serving the needs of our patients. We, as an organization, we don't use healthcare insurance, or we don't bill via healthcare insurance. And so we see all patients regardless of creed, color, doesn't matter, socioeconomic status. And so I think we've had a very good rooting as an organization that we take all comers, we serve all comers, and we'll continue to do that. And that goes all the way to the leadership of our organization, where we have folks of all different backgrounds, genders, and so I think I'm really fortunate to be in an organization like that. It's interesting. I think that one of the things for me that I've learned most is, I've got young kids, and I spent more time at home, they spent more time at home, and so I think as parents, you get to actually learn what your kid is learning, what they know and what they don't know, who their influences are. And it's been really great for me to spend more time with my kids, and also get to have a little bit more of an active role in their education. That was certainly the case early on. Now, we've also realized that as parents, you can't do it all, and you need professionals to help you with that stuff. And that's why there are teachers, and that way you'll continue to have a good relationship with your kids. And mine are really little, they're 9 and 7. So sometimes when you're so bogged down in what you're doing with your life, something like this, the social distancing, meant we were all at home a little bit more, and we got to know a heck of a lot more about what was going on with our kids.